Fashion because we have a very busy agenda at the meeting. I want to welcome all of you for coming. Actually, thank you for coming. It's kind of weird to be talking to empty seats, so it's better to be filled with people. I hope you all got a chance to look at the agenda that's been posted in the appropriate number of days in advance, and according to the rules and regulations. And I'd like to call the meeting to order. It's now, it says here I have to say the time. It is 4:02 p.m. Where are they? I take that back. Can't call the meeting to order yet. So what's new? How is everybody? I thought the next time I would wear a suit after I retired would be my grandchild's bar mitzvah, but it's 4 years from now, and here I am with a suit and tie. I'm just killing time. Excellent. Where are they? Two demerits for you guys for being late. Hello, Grant Thornton. Where's Samantha? Oh, there you are. Is there a seat for her? Yeah. Oh, okay. Okay. We're now present. So the meeting opens at 4:04 p.m. So we'll now have a roll call to see who is here and that we have the appropriate number of directors here. So let's go from left to right. Me.
Amy Flores.
Jason Abelov. Rory Lantzman.
All right. I see that we have all 7 board members in attendance, and therefore we have a quorum. So the first item on the agenda, as always at these meetings, is approval of the minutes of the last meeting, which are the minutes of July 19th, 2025. All the board members have copies in their packets. Who would like to make a motion to approve? Second? Second. All those in favor? Aye. Opposed? Motion is adopted. We now turn to, oddly enough, the question of the 2024 financial statements and the audit of those financial statements. Those financial statements were theoretically due much earlier than now, but the prior board never approved them at the time they were supposed to. Yet the county needs them, and we have thoroughly gone over them, and we're going to present that in public, the highlights of that in public, and we will ask the board whether they want to approve that or not. And I have to say, we're so grateful for the help of Samantha McLaughlin, who is the controller. She performed beautifully. That's just not our opinion. That's the opinion of the auditors. And I would ask Samantha to as acting controller to give us an outline and take the microphone.
Good afternoon, everyone. I was asked to give a brief overview of the financial performance for 2024. Our total change in net position at December 31st, 2024 was $148 million. This was a $72 million increase from the prior year. This was primarily due to two non-recurring items for revenue. The first one being a non-operating activity regarding health insurance relief funding that was received from New York State in the amount of $60 million in 2023. And the second item was roughly $25 million of prior year DISH IGT funding that was recognized in 2023. Overall expenses remained relatively constant with a slight decrease of $5 million. One other item to note on the statement of revenue, expenses, and change in net position is NHCC did adopt a new Governmental Accounting Standards Board standard, GASB 101, related to compensated absences. The cumulative effect of GASB 101 was $6.4 million, which is illustrated in the 2022 column as a change to the end of year net position. Looking at the balance sheet, total assets remained fairly constant with an increase of $6 million, roughly 1% between 2023 to 2024. The two items I would like to highlight are related to liabilities. Current liabilities did increase roughly $97 million. This was primarily due to accounts payable and accrued expenses, primarily related to the New York State health insurance premiums that NHCC is accruing on a monthly basis. Other long-term liabilities increased roughly $91 million, and that's a combination of actuarial valuations pertaining to the pension and other post-employment benefits that are performed on an annual basis. So those are the highlights of the 2024 financials. If the board has any questions, I'd be happy to answer them. If there are no questions, I'll turn it over to Grant Thornton to give their presentation. Sure.
Okay, as we pull up the slides, I'm Tammy Ordinsky. I'm the audit partner for the external financial statement audit from Grant Thornton. And with me today, I have Brian Hopkins, who is our senior manager. And we're going to go through very high level the required communications as part of our financial statement audit. And we're talking about the December 31st, 2024 financials that Sam just presented on. And really, thank you. I'll echo what you said earlier. Thank you to Sam for really getting us to where we are today. So as of August 11th, just a couple of days ago when we prepared this presentation, there's a couple of things that are open. I just think it's important for the board to know. The final review of the financial statements, any legal representation letters, management representation letters, including procedures as we wrap up our financial statement audit process. These are the deliverables that we audited as part of our financial statement audit, the December 31st, 2024 financial statements, the audited financial statements of which is with the Cayman Islands, as well as the uniform guidance, your single audit as a result of the federal funding that you receive, which is due not until September 30th. These are the responsibilities under the financial statement audit under GAS and government auditing standards. And this slide highlights the responsibilities of those charged with governance, so the board, as well as management's responsibility as part of the audit process. I won't go through all of these in detail, but this highlights some of the things that, from a governance perspective, that both the board and management is responsible for. I'm going to turn over to Brian, who's going to highlight some of the areas of focus as part of our audit process.
Sure. Thank you, Tammy, and good evening, everyone. So starting on this slide, I'm just going to highlight some of the significant risk areas and areas of focus for our audit. Really, our approach was consistent with what it's been in the past. The first area we focus on are the patient revenues and related accounts receivables. So we performed testing over revenues that were recognized during the year, making sure that they were billed at the appropriate rates and that the services were in fact performed. We looked at receivables that were outstanding as of year end to make sure there was an appropriate allowance for doubtful accounts applied to those. Primarily we looked at is subsequent cash receipts that came in after the year end to make sure that those receivables were appropriately stated, and based on the procedures we performed, we were comfortable that they were. Another area that's a risk, not just for our audit of NUMIC, but for any financial statement audit, is the risk of management override of controls. So to address that, we performed interviews with individuals throughout the finance function to make sure that they weren't aware of any fraud or were asked to make any journal entries that were inappropriate. And then we performed testing over journal entries themselves by selecting certain entries for testing to make sure that there was an appropriate level of segregation of duties throughout the process and that the entry was appropriate to record for the period. We also confirmed cash and investment balances directly with the financial institutions. We tested property and equipment, looking at any significant additions that were recognized during the year and that there's an appropriate useful life assigned to the fixed assets. We also confirmed debt balances directly with the lenders. We looked at related party transactions, make sure that there's appropriate disclosure related to those. We also involve actuaries to look at the post-retirement benefit liabilities to make sure that the assumptions and methodologies that are used by the actuaries that NUMIC engaged were appropriate, and based on those reviews, they were appropriately stated. This slide just gives a little context to the journal entry testing that I mentioned earlier. We just give that for a little more information. And then also we involve IT specialists as part of our audit process to look at the IT security controls, looking at things like logical access, who has access to what within the system, that there's appropriate segregation of duties related to change management, so onboarding new users into the system, as well as deprovisioning access to users who are no longer with the organization. As a result of those procedures, there was one significant deficiency related to administrative access rights to one of the systems, which is a recurring finding and is really just due to management waiting for implementation of a new system possibly, and just the need to have administrative rights rest with individuals outside of the IT function. So management's aware of that and will remediate it in the future.
Okay, so the rest of this is required communications as it relates to going concern matters or fraud or any significant, oh, sorry. Is that better? Oh, sorry. Any significant deficiencies or significant difficulties encountered throughout the audit process. This just lists the accounting policies, which you can see clearly in the financial statements, as well as any accounting estimates used, of which the post-retirement liability is one that Brian just touched on, and the disclosures to the financial statements as well. As it relates to internal control matters, Brian just mentioned one, the significant deficiency related to IT. The second relates to claims processing. This is all listed in the external financial statements in the back as it relates to the findings. And this just lists some of the other individuals or entities used in a description of the relevant areas of audit risk. I won't go into any of these in detail. And this just reconfirms every single year as part of our audit process, we reconfirm our independence with NUMIC. And then this is just our ethics hotline, and if you want to contact any of us. That's it. Any questions?
Thank you very much. I've had experience with Grant Thornton in prior positions, and they're a terrific firm. And I know this was a difficult, little more difficult because of the absence of the people who actually did the audit, work with you on the audit. But you know, we're very comfortable with what you did and with the audit results. So there'll be an opportunity in executive session for any trustee who has a particular question about one of the details, any of the details in the audit. It was in your package. is in your package, but I think that we can vote if there's a motion to approve the 2024 audit as of the financials and the report as contained in your meeting materials. Second? Questions? All in favor? Aye. Opposed? Motion passed. All right, I now turn it over to our fantastic interim president and CEO. Oh, maybe he's not here. Oh, no, yeah, he's there. Dr. Becker has a brief report to make on the state of the world at the Nassau University Medical Center.
Thank you, Stuart, or Mr. Chairman. Thanks. Welcome, everybody. The first order of business is really to thank the board for an amazing amount of time, guidance, wisdom. Mr. Rabinowitz, Mr. Chairman, especially you. I don't know if you expected to get to know me as well as you have, but that's the breaks. We're not related. And it's been a pleasure. The support's been amazing and really inspiring as far as the confidence that the board has in the team and even more than the team, just the people who work here. And that's really been inspiring to us as well. The second group to thank profusely is the new management team, who seem to have aggregated in this little area here. So stand and wave for a second. You guys are amazing. Again, and Sam, you're part of that. So please, but just doing an incredible job. So much to learn and discover as we are. But we're very optimistic, and we'll talk a little bit about what we've found. And then the third group to thank, without which this would just not be possible, are our outside support team, the Manat team, who we're just incredibly grateful for, who are providing not just legal support, but operational insight, clinical insight, financial insight, and just really tremendous levels of support, and the Deloitte team as well. And we'll talk about all the great work that they've done, including a new management tool that, under our guidance, they are in the process of building, which is going to really be helpful. I figured it out. Thank you. So what I want to do, and I'll try and be as brief as possible. I know that there's a lot to cover today, but we want to provide an overview. I'll give you an executive summary around general issues and challenges that we have, a brief review of our current findings, clinical, operational, and financial, highlight the recent progress and define near-term priorities, and provide a summary. And actually, there's no appendix. The appendix is for the board, just a lot more level of detail that the board's been provided with, and that we'll review with them in executive session and be open to questions. We had some recent town hall meetings. They were very well attended. They were wonderful. We did them kind of around the clock. The turnout was great. But I always like to start with the mission, vision, and values. I think as a CEO and even as a provider or as a staff member, it's important just to take a look at this and remember why we're here, what we're doing, and how we're doing it. I won't spend a lot of time on it except to remind ourselves that we're really here to provide comprehensive, high-quality care to the residents of Nassau County, as well as people who are living here and have no access to or no alternative to care. And I think that has to be equitable and quality health care for all. We do an amazing job of that here. It's not always reflected in the documents or the reputation and so on, but let me tell you, from walking around and seeing what we see, it's really quite impressive, and we do an amazing job here. So I think it's important to reflect on this and to see it and remember why we're doing what we're doing. I'm not going to review each value, but we do spend time talking about these one at a time, and it's important. I'm used to building the plane while flying it. I've also drank from a fire hose, but I've never really done both at the same time. And so this is a first, admittedly, but it's an amazing experience. We know the history, but despite those events, the new management team is really digging in, establishing a new mindset every time, and it's being felt throughout the organization, at least people I bump into and introduce themselves to me. It's incredible. I think it's important to take time to tell you that because it's really happening and people feel kind of the change in approach to how we're running this place and what the vision is and how we're driving towards that. Step one, of course, was to recruit the team. I think we're almost done with that. We'll show you that. A lot of distressed safety net healthcare experience, and we're engaging at every level. Step two was 2A, to perform a quick but detailed clinical, operational, and financial assessment while also addressing urgent issues. We're doing that. I'll show you some of the high level of that. 2B, which is ongoing, is to seek much needed financial assistance, capital assistance, and operating support to meet some of the immediate cash flow needs that we have. We are working very closely with the state at a pace that, having worked at the state, I've never seen before. So we're getting very positive support and hope to receive the support that we need as a bridge going forward. So we're excited about that. And then step three, which we have not really initiated yet, but will, I think, soon, is to start to think about how to reshape, restructure, and transform the organization so that it can remain a sustainable or become a sustainable medical center that continues to fill its mission and its vision. And that will be a complex piece. Just to summarize, and I'll try not to be too repetitive, but I talked about the management team from a clinical perspective. A lot of quality healthcare services here, but it's very disorganized and highly variable healthcare delivery structure. Processes and systems that result in low clinical productivity and performance metrics with inefficient delivery of outpatient, inpatient, and long-term care. The long-term care facility, of course, is A. Holly Patterson. So that's not to criticize any person, and it shouldn't be taken that way. It's the processes, it's the structure, it's years of just improper attention to detail and improper management that have gotten us here. And that's kind of where we are clinically. Operationally, kind of the same thing, but in operational terms. Really a lack of data-driven and disciplined management of operations over many years that has resulted in dramatic overruns in cost, erosion of service and quality, all despite some very, very hardworking staff. The financial assessment, it is where it is. You started to hear part of it from Samantha and GT. Short-term liquidity concerns, which is why we're in deep discussions with the state for bridge financing. Poor revenue cycle management. The opportunities are staggering, we think, and we're addressing those. Significant expense overruns. We currently lose $2.8 million per week. Big number, unsustainable, and we need to turn it around. And that's what we're focused on. As I mentioned, we expect significant bridge funding from New York State to create time for implementation of really what will be multiple mitigation strategies. We have a long-term debt on the balance sheet that exceeds $1 billion. That's part of step three. The long-term piece is figuring out how to manage that. And there will be, I'm sure, deep discussions on that. And then, we're very focused on supporting our most valuable asset. And I can't say it enough. It's really the staff here, the physicians, the nurses, the clinicians, the non-clinicians. It's amazing the dedication and commitment that is here. And we are really trying to identify, not just big wins, but small wins that make a difference in everyday life here at such an important medical center. So we are moving aggressively. My mantra, and my team's heard it so much that they're tired of it, but you all haven't, is every week is a month. That means that we need to get done in a week, which you normally get done in a month. And so, it feels like that to them and to me, and we're moving aggressively to implement a lot of change and just learn a lot as we go. Strengths, weaknesses, opportunities, and threats. I won't go through this entirely. You've heard a lot of it. We're delivering quality patient care. We don't always document it well, but our clinical designations are being maintained. many years as a weakness of undisciplined, low-performing clinical, operational, and financial management. It just is what it is. It's created some staff shortages, cost overruns, an inability to recruit and retain well, and suboptimal performance outcomes. On top of that, we've not invested properly in the types of systems, information systems, and other types of systems that support management. This has not been an organization that has relied on data-driven management, which is what you would expect and actually what you need in such a complex medical center. So the opportunities to do that, to design tools, use those tools to effectively manage clinical, operational, and financial targets and outcomes is essential, and that's what we're doing. And we've accomplished a lot. The threats, of course, are what we talked about financially, the liabilities, the operating losses, the high capital requirements that are needed to bring this facility up to where it needs to be, to replace and repair aging systems and infrastructure. Some of the vendor relationships have not been well managed, lengthy contract execution times. There's a lot of stuff that threatens the organization. Reputationally, it's suffered. We need to repair that. We're in the process of doing that. There are a lot of good stories here, and I mean a lot of good stories here that just haven't been told. Other things have occupied the headlines. We're going to reverse that trend. And of course, it's a challenging payer mix, right? We're taking care of people, at least 10 or 15%, perhaps more, of patients we serve have no ability to pay. And that has a financial impact. So we need to figure out how we can sustain this organization while serving those patients who are most vulnerable. This is what the table of organization looked like. All the red were missing positions the day before I got here. And we've had a tremendous success in where we are now, right? The light blue I expect to be filled in the next 2 to 3 weeks. And so we're excited about that. Fastest set of recruitments I've ever done. And we haven't compromised in quality, quite the opposite. We've attracted people here who are just top at everything they do, and we're excited about that. You heard a little bit about this. I won't repeat it. These are the financials, but you can see that this is just not a sustainable picture. And we're going to stay focused on reversing this. We're on track for $160 to $180 million of operating loss in 2025. That is just not sustainable. But the good news is there's a lot of opportunity here. You can't fix 2025, but so much. We hope to make a little progress, but in fact, some of the things that we need to address will require additional investment, and we hope that yields a better, and we know that will yield a better 2026 performance, which is encouraging to us. But it hasn't stopped us from reorganizing how care is delivered, and we expect to see at least some impact of that in 2025. If I'm being vague, it's because I don't really know what the outcome will be. Been here not quite 2 months, and we're really kind of moving quickly with the idea that everything we do will have a positive impact, which will yield a positive financial impact as well. The big question is, when does that happen? And stay tuned. Clinical services, just to give you a little bit of flavor of what we're seeing, just lack of efficient communication. We've started to fix that already between leadership managers and frontline staff. Lack of geographic rounding, things as simple as case management being on a different floor than where their patients are, than where the team is. And so organizing all of that geographically makes a big difference in our efficiency and improving the time that patients spend in the hospital, so that we want to get patients out as fast as we can because that's what patients want and that's what's best for their care. We have a lower inpatient census because we're not utilized as much as we'd like to be, and that really worsens the impact of fixed costs. We have high short-stay admissions and high denial rates. That's a specific issue around observation patients being categorized the wrong way, and we can fix that. Again, not a good peer-to-peer review process, increasing the risk of denials, poor charting compliance. Our residents aren't getting the oversight they need. They also need more resources to chart the right way, and so there's a lot to fix there. On the outpatient side, lack of appointment confirmations, all the basic things that many of us have and utilize to go see the doctor don't exist here the way they should, and they create inefficiency and frustration for both patients and for staff. And so we need to really fix that. Again, it doesn't get fixed overnight, but the first step is to identify it and then start to move on it. I'm happy to say that our staff and our physicians and teams, our nurses, everyone's engaged in this, and we've received, almost no pushback on, great, thank you for identifying that, let's fix it. And that's the right attitude, okay? Operations, very fragmented approach to operations existed, a lot of redundant leadership skills, just people managing things that they really weren't necessarily skilled or best at managing. The T of O I showed you is restructured. Each one of those areas has a restructured, sub-level of organization that's getting looked at and reorganized. People are shell-shocked who work here from so much turnover and so much change, and we're trying to stabilize that. Yet there's still amazingly an incredibly great attitude and a real culture of engagement and service here. I've never, and our folks on our team who are new have never seen anything like it, especially given the context of what people have been through here as far as the amount of change. It's frankly amazing. People are just, very positive and hopeful, and we appreciate that. The hiring process is cumbersome. We want to address that and figure out the best way to be able to hire efficiently, recruit and retain. The pay scale is not competitive. We're speaking about that. We need to learn more about it and where we can invest. That will be a net positive both in stabilizing the staff and hopefully improving the expense side. We think that there's a lot of room to improve on the expense side. Costing less and paying people more don't necessarily oppose each other, and we're figuring out how to make that work, and that's going to be something we're very focused on. You can't just expect the benefit package to be the sole attractant to working here. It's a great benefit package, but it's not alone what will recruit and ultimately retain the right group of people here. So we're focused on this, and I tell you this so that you're aware of where we are focused. IT services, cover, and I didn't realize this, perhaps you don't, but not only the medical center and not only A. Holly Patterson, our extended care facility, but we also support the county jail and our FQHCs. So there's a lot to support. There's a lot on their plate. Many of the systems are outdated. We're working on improving those. There are a lot of different challenges, and I won't go through all of them, but there's a lot of opportunity here to improve and provide this medical center with the type of systems that lend themselves to modern day management. Our accomplishments, again, I think this is worth the 2 slides that I've created for this. Just initiated a process to stabilize the cash position of the medical center. As I said, we're in deep discussions with the state. We've got great support from the board, great support from NIFA, and frankly, great support with the state. The responsiveness of the Department of Health and the executive branch have been incredible as far as working closely with us to provide support, and we hope to hear more on that very soon. I mentioned new management, and that's great. Continuity of service, we haven't missed a beat on this. We're working hard because there are many gaps that we're trying to fill, and we're engaged with our clinical chairs to make sure that we can continue the level of service that we've always had. The staff has been re-engaged, or that's a process, but we had, as I said, some great town hall meetings, and we're working on many different ways to engage our staff so that they feel heard and that they know that we see them and that we're getting to hear the issues that concern them the most, and then figuring out ways where we can to address those issues in a very tangible and concrete manner. We just are in the process of completing an initial analysis of clinical, operational, and financial areas. We probably have 60 different SWOT analyses, something similar to what I just showed you for each department. We're working through those and are trying to understand the details of those. That's very important. We're developing a new toolkit. I'll show you just a snapshot of that, but some data-driven tools that allow us to really manage, more objectively rather than shooting from the hip. And then reviewing our existing contracts. Many contracts were expired. Many are just not good contracts. We've got some vendors that are underperforming relative to what we're paying for and relative to just an expectation of good performance, and we're addressing that with them. We're doing a detailed capital needs assessment. It will require some thought on what to prioritize. The capital needs will be more than the available capital. I can promise you that with great certainty, but we need to figure out what the short-term plan is and then talk to the state and others about partnership and investment for a more sustainable future here. We will work closely with the board to help develop that. We've focused on a few specific areas: perioperative services, outpatient services, our staffing, and our inpatient delivery of care processes. Those are just a few of the areas where we've got really targeted efforts that will help us build a budget for 2026 that's more accurate than what was put forth in 2025, and something that we hope we can meet. I mentioned restructuring the delivery of care, revenue cycle, payer contracting improvements. There's so many things that are happening on both the expense and revenue side. I won't spend time talking about it, but we expect to see very positive yields and improvements to the bottom line over hopefully not too long. And then, our new CFO, who I think this is day 3 for Rich Miller, who's here. We're thrilled to have him, but he's going to start very soon the process of building the budget for 2026. And again, we've got a lot of data to sift through to build an informed and achievable budget and understand what that looks like. But that's something that we'll hope to present to the board in the late fall for approval. My next to last slide, I appreciate your patience. This is just an example, and we work closely with our friends from Deloitte to develop this. They did most of the work. We just got to explain the vision. But this is a data management tool that kind of links clinical, operational, and financial performance. There's a lot more detail to this, and we're just still building it with them. But it allows us and our management team to really use objective data as much as we can inform it to analyze each of these areas and see where a clinical decision has an impact on operations and finances, where a financial decision might have an impact on operations and clinical and so on. And understanding that coordination and that balance is critical to running a complex medical center such as this. That's it. The bad news, as I mentioned, there's a lot to fix, but there's good news. I'm a half full kind of guy. There's a lot that's fixable, and we're already seeing results. We're already starting to fix it. Again, couldn't do this without the team, without the staff, who are really optimistic. We're going to preserve the mission. A lot of significant changes to make, but we'll get there, and we will end up with sustainable services the community needs and utilizes. I talk about the bottom box a lot. The key focus here is better access, better experience, and better outcomes, and we're just going to, attack that continuously. So thank you. Appreciate again all the support and the attendance, and I'll turn it back over to you, Mr. Chairman.
Thank you very much, Dr. Becker. I can assure everybody here that the board is fully behind and fully supportive of Dr. Becker's approach. We do not believe that if you truly want to fix something, you can do that without finding out what went wrong. And, what went wrong is over a period of many, many years. Things happened, and we did not keep up. Sometimes they were right at the time, but we did not keep up sometimes in some areas with new developments. And also, we promise you full transparency. I mean, we're not hiding the bad news from anybody. You're entitled to hear the bad news. You're entitled to know about it. And this is a public institution, and we want to be transparent. And that's what we will do. You're also entitled to know that the board is fully and committed, as is Dr. Becker and the management team, to making this place as strong as it can be and maintaining, most importantly, its mission. We also want to hear from you. We want to learn from you. You know, there are like 5 floors. Why are there 5 floors between the 15th and the 19th floor that separates out? Well, never mind. But anyway, we want to hear from you. So we have as we did last time, and we will do it at every meeting, we will have a period of public comment or questions. We don't, it's not a debate, so we won't necessarily answer all the questions. Please, if you have a comment or question, address it to me or to Dr. Becker rather than to individuals on the board. But, my understanding is that, usually we ask people to register beforehand, but nobody has. Is that correct? So if you want to speak anyway, you have 3 minutes so that each. So anybody want to make a statement? Yes. Do we have a microphone for this gentleman? And if you oh, that's fine. I can project. Wow, that's a great voice.
First off, very nice to meet you, Mr. Chairman.
Nice to meet you.
Board for coming today. My name is Dr. Peter Atala. I'm one of the senior resident physicians here in our hospital. And I'm the representative for over 350 resident physicians and fellow physicians here in our hospital. And I want to thank Dr. Becker. He has agreed to a meeting with us in the upcoming weeks to discuss our position in the hospital, which we believe is particularly challenging and complex. And for the sake of time, I'm not going to go into any details now. I don't want to bore anyone, but I just wanted to welcome the board. I do have a brief document that just outlines some of the major points that I would love to share with you once this meeting is done, and feel free to read it or not whenever you have time. That's all I wanted to share.
Thank you. And we are very interested in getting that document and seeing what you have to say. And I have to say that on a personal basis, my own daughter is a physician, has been a resident and a fellow at different hospitals than this one. I have a lot of empathy for what the residents and the fellows go through. And we certainly want our residents and fellows to be not just well-educated, but happy with their experience here. So we will take it seriously, and we'll take a look at it. Thank you. There being no other comments, I thank you for it very much. And now we go into executive session. If we need a motion to do so. Hold it. Dean, they made me read this. I will now entertain a motion for the directors to conduct an executive session pursuant to Public Officer Law 105, which I'm sure you all know like the back of your hand, for the purpose of considering matters leading in the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person and proposed pending or current litigation. Suffice to say, these are the reasons we're going into executive session. At the end of executive session, if the motion is made, seconded, and passed, we will go there and then come back afterwards to announce some decisions that we make in executive session for your benefit. If anybody wants to stay, I should warn you it's going to be a little while because it's a very heavy agenda. So is there a motion for us to go into executive session? Second? Okay. Any discussion? All in favor? Thank you. Motion is passed. Let's go into executive session, and for those who stay, we'll see you later. This is not helping. Everybody, because everybody should not talk into the same mic. You know. I'm thinking COVID or respiratory syndrome.
Yeah, we're getting
We'll have our mouth.
three handheld mics and another loud mic to upgrade with the old one we have here. This is a few years old. I do apologize.
I know it's not your duty.
You, a chair.
Okay. Do I have a, do we need a motion to go back into open session? Back, okay. We're here. That's good enough. All right. In executive session, we voted on and approved two very important resolutions. And I will ask Doug, who's a better and quicker oral reader than I am, to read those resolutions.
The first one, Resolution 107-2025, to authorize the filing of a legal complaint against Meg C. Ryan, seeking recovery for the substantial damage she has caused the corporation. Whereas the Board of Directors of the Nassau Healthcare Corporation has convened a meeting in accordance with its bylaws, and whereas the Board of Directors has determined, after thorough legal and financial investigations, that Meg C. Ryan's mismanagement has caused substantial and widespread harm to the corporation, and whereas the Board of Directors deems it advisable and in the best interest of the corporation to authorize the interim president and CEO to direct the corporation's lawyers to file a complaint against Meg C. Ryan, seeking recovery for the substantial damage she has caused the corporation. Now, therefore, be it resolved that the board hereby authorizes Dr. Richard Becker, in his capacity as interim president and CEO, to direct the corporation's lawyers to file a legal complaint against Meg C. Ryan and to undertake any actions necessary in his judgment to seek recovery for any and all losses and damages Ms. Ryan has caused to the corporation. And be it further resolved that all actions taken heretofore to begin implementation of this resolution are hereby ratified and confirmed. The next resolution is number 118-2025. And this resolution is to authorize certain actions by board chair and president and CEO related to litigation. Whereas the Board of Directors of the Nassau Healthcare Corporation filed the following three lawsuits against the New York State Department of Health, New York State, and Nassau County Interim Finance Authority, asserting various claims relating to Medicaid supplemental payments. Nassau University Medical Center versus Nassau County Interim Finance Authority, index number 621358/2024, in the New York Superior Court of Nassau County, commenced on or about December 3rd, 2024. Nassau University Medical Center versus New York State Department of Health, index number 621823-2024, New York Superior Court, Nassau County, commenced on or about December 6, 2024, and Nassau Healthcare Corporation, DBA, Nassau University Medical Center versus the State of New York, claim number 143067, New York Court of Claims, commenced on or about December 27, 2024. Whereas the claims asserted in the litigation are based upon allegations that it is unlawful for NHCC to transfer funds to contribute to the non-federal share of New York's Medicaid funding in order to ultimately fund Nassau University Medical Center's own DISH hospital payments because New York State is required to contribute NHCC's non-federal share. Whereas on or about June 1st, 2025, a new board of NHCC was appointed pursuant to legislation enacted in the state fiscal year 2026 budget that amended the governance structure of NHCC. And whereas the new board engaged experienced national counsel with expertise in Medicaid financing to advise it on the merits of the litigation and to consider whether and to what extent it would be in the best interest of NHCC to pursue the litigation. Whereas counsel has performed a detailed analysis of the litigation, including but not limited to a review of the facts, the relevant legal and regulatory authority, guidance from federal and other regulatory agencies, past practices, and comparable examples from other hospitals in New York and in other states. Whereas the new board has engaged in detailed deliberations over 2 meetings to consider the above referenced analysis. And whereas the new board has determined that the transfers that are the subject of the litigation are a ubiquitous practice in dozens of states and hospitals across the country and have become a standard arrangement for financing supplemental payments to hundreds of hospitals. And whereas the new board has determined that even if NHCC were to prevail in the litigation, the state would have no obligation to fund the non-federal share of most supplemental payments to NUMC, meaning that victory in the litigation could cut off NHCC from a lifeline of federal funding in the future and could even lead to recoupment of previously received DISH payments, leaving NHCC in a far worse position than before it commenced the litigation. And whereas after detailed review and discussion, and in light of the above, the new board has determined that there is no merit to the litigation, that the former chief executive officer and chief legal officer, Meg Ryan, knew there was no merit to the litigation, and that it is in the best interest of NHCC to dismiss the litigation. And now, therefore, be it resolved that the board authorizes the chair and the interim president and CEO to dismiss the litigation with prejudice, and be it further resolved that all actions taken heretofore to begin implementation of this resolution are hereby ratified and confirmed.
Thank you. And I would just add that each of these resolutions were passed unanimously by the board with no abstentions or obviously no votes. Those were all the board actions in executive session that require a public announcement. Nothing else was done in executive session that would require a public announcement of the results thereof. Next item on the agenda is a report of the chairman. I really don't want to go through it. I don't have a long report. I just want to report that Corn Ferry, as you all know, has been retained in the search for a permanent CEO and has begun work. I have directed, they wanted to talk to people in the community, so stakeholders in the community, who, as to what they thought, what kinds of characteristics, what kinds of attitude, what kinds of talent they thought we should have in searching for this permanent CEO. And so I directed them to speak to every member of the committee, the search committee, and also the ex officio members of the search committee, who consist of a representative of the medical people, a representative of the nursing people, and one other. Who? Oh, me. Okay. But they also want to talk to every single trustee, and we also told them they need to talk to our union representatives. I don't know if they've been in touch with you yet, but Rich is going to give them your contact information. The union is every bit a member of our community as anybody, and our stakeholders in our future, and we want to get your input into the union input as well. And so the search has begun. A couple of people whose names at this point I can't mention have expressed interest, and we'll see. Next item is we have to consider and vote upon a number of resolutions, some dealing with personnel appointments. At the last meeting, I appointed the Medical and Professional Affairs Committee of the board. We need a Medical and Professional Affairs Committee based on the bylaws. And I appointed that committee, and I asked for a motion to full board to approve those appointments. Any discussion? Okay. Nobody's going to object to this. I also need to appoint a legal and audit and compliance committee of the board, and I would. That's obviously a really important committee for us. Again, dictated by the bylaws, although maybe there were separate committees which we're now combining into one. And I have asked the following following board members to be on that committee: Rory Lantzman, Jason Abelov, and Dean, I can't pronounce your last name, okay. And I've asked Dean to chair it, and all of these people, pending the approval of the board, have agreed to serve and to chair. So can I have a motion to approve this committee and the appointments there too? A second? Okay. This committee would be authorized to approve contracts between $50,000 and $250,000 without prior board approval, but they would report any of these approved contracts to the full board. It becomes important to us to be able to move more quickly than we've been moving, and since there are so few board members and difficult to get a quorum on any given day, I think this is the way to proceed. All in favor? Opposed? None. Okay. Now, am I done with that? Yeah. Where are the bylaws? I thought I'm going to introduce our chief financial officer, and ask the board to approve a resolution appointing him as an officer of the corporation formally, even though he has been here for 3 days already, acting as our CFO. We're lucky to have him. He's got incredible experience, and it's remarkable that you've agreed to do this. So, anyway, is there a motion to formally appoint Richard Miller? I second it. Any discussion? All in favor? Aye. Now, where is the bylaw thingamajig? Yes, do it.
Correct. Yeah, the proposed bylaw changes have been in your packets. I'll just very quickly summarize them for your consideration. You'll vote at the next meeting. It's mostly to incorporate the changes to the law. So as you know, the board changed, and that's now incorporated in the bylaws. The quorum requirements changed. It was 60%. Now it's a majority. That's in the bylaws. There's a provision around video conferencing, which is now basically incorporating existing law to allow you to do that under certain circumstances. There is the committee structure that's conforming to law, and NIFA now has the authority, the responsibility to approve all contracts over $1 million as part of the legislation. So all of this is included in the bylaws, and you'll take a vote at the next meeting.
Thank you. And we will form a bylaw committee of the board to consider any changes or new bylaws to the existing ones. But these are changes that essentially had to be made, and so they were made by council. Now we have a number of priority vendor contracts that need to be approved. There's a ton of vendor contracts that are expired or expiring or we ended, and new contracts have to be approved. Doug, you're going to read the vendor contract approval? You did such a good job with reading the resolution.
I will spare you from reading through all of the contracts. They have been in the packets. They were posted on the site today. So unless there are specific questions, I think you can just take one motion to cover that resolution.
Each contract has been gone over very carefully by legal and by the rest of the management team, and the board has been informed of the details of many of them and highlights of the others. So I ask for a motion to approve the contracts that are in your packet. Motion? Okay, second? Second. All in favor? All right. Now, approval of credentials. It says Doug.
You could do this perfectly fine, Mr. Chairman, but this is the standard credentialing board. It's gone through all of the committees and it's come to the board for routine approval of the credentials.
I could have done that, right. I told you last time that I am impressed by the credentialing process. I went to meetings by Zoom. I had a couple of meetings, and they're done in depth, carefully, thoroughly by the committees that are charged with making these determinations, and I have full confidence in them. So our job is not to look at each credential packet, but rather to make sure each credential went through the appropriate process for examination and then discussion and debate, and I can assure you they have. Do we need a motion on that? Yes, we need a motion on the credentialing packet to approve it, which was distributed prior to the meeting and included in your credentials, in your materials. Motion to approve. Second is the scribe noting who did all this. Thank you very much. Excellent scribe, excellent reader, excellent scribe. All those in favor? Opposed? None. If there's no further business, then I ask for a motion to adjourn. Is there any further business? Okay. Hearing none, is there a motion to adjourn? I second. All in favor? Opposed? Unanimously passed at, my watch is not exactly right, but 6:57. 53. That's okay. These Roman numerals will get you every time. It's been a long 2 months, and it's been a long day. Thank you all very much. We're adjourned.